Hello, my name is Dr. Dewan S. Raja. Today I will discuss about osteology of the tibia. First of all, we'll go to the anatomical points and site determination. So how can I hold the bone in anatomical position? So this is the tibia. It has upper end expanded. It is two condyle. Lower end has medial malleolus. Anteriorly the anterior border, and upper part of the anterior border we have the tibial tuberosity here. So this is the right tibia. Okay, so the tibia is the medial bone of the leg, which is homologous to the radius. It is a long bone with upper end shaft. This is the upper end, this is the shaft, and this is the lower end. We have to identify some structure here. Again, here medial condyle, and this is the medial malleolus, and this is the tibial tuberosity, lateral condyle here, and we have the posteriorly have the soleal line here, and we have the between the on the articular surface of the condyle we have the intercondylar eminence here. Okay, and tibia is attached to the fibula by interosseous membrane. There is an opening in the upper part of the interosseous membrane for the passage of the anterior tibial vessels, and there is opening in the lower part of the interosseous membrane for the opening for the passage of the fibular, a branch of the fibular artery, perforating branch of the fibular artery. The tibia makes a joint with superior tibiofibular joint. There is a plain type synovial joint. The tibia and fibula are connected by the interosseous membrane forming the fibrous joint. Here, lower inferior tibiofibular joint, there is a syndesmosis. Okay, there is also a one type of synovial joint. Okay, we got that. Here, we'll come here. Joints of the tibia, knee joint. What type of joint? Knee joint is compound synovial joint incorporating two condylar joint between the condyles of the femur. One condyle, another condyle. Here is the condyle. This is the medial condyle of the tibia. So it is a condylar type of joint between the condyles of tibia with that of the femur, and also have saddle joint, that is a joint between the patella and the femur. That is the saddle joint. That is the knee joint. Superior tibiofibular joint, synovial joint of plain variety. This is the superior tibiofibular joint. Middle tibiofibular joint, fibrous joint here. Okay, and inferior tibiofibular joint, that is the syndesmosis. Ankle joint is the hinge variety of synovial joint. We have some ligament here. Here is the patellar ligament or ligamentum patelli going attaching to the tibial tuberosity. Is a continuation of the quadriceps femoris tendon. Here is the tibial collateral ligament here. Okay, we'll go inside the knee joint, multiple ligaments, and also the meniscus. We'll find out that the medial meniscus, lateral meniscus, okay, and the cruciate ligaments. Okay, if you look at the radiology, you can easily identify this is the femur has two condyle, tibia has two condyle, forms the condylar type of synovial joint. This is the patella, forms joint with that of the lower part of the femur as the saddle type of synovial joint. Superior tibiofibular joint is a plain type of synovial joint. Here there is a talus bone, forms joints with the tibia, that is the ankle joint, and that is a hinge type of synovial joint. Okay, we have to identify this all structure: lateral condyle, medial condyle, intercondylar eminence. Okay, so intercondylar eminence, anterior intercondylar area, posterior intercondylar area. Tibial tuberosity is very important here. Tibial tuberosity, guard is tubercle, that is present on the anterior part of the lateral condyle for the insertion of the iliotibial tract. okay, or you can also call iliotibial band. Shaft of the tibia, this is the soleal line is present posteriorly, posterior surface. Nutrient foramen is very close to the soleal line on the posterior aspect. Okay, this is the largest nutrient artery of the body. Okay, and our tibia is the second longest bone of our body. Okay, lateral surface, we'll find out the lateral surface here. We have the medial surface and the posterior surface, anterior border, interosseous border or lateral border. We have the medial border. Okay, we have the malleolar groove. Okay, we have the malleolar groove, articular facet on the medial malleolus. Inferior articular surface is here, inferior articular surface. Okay, we got the identification. Now we'll go to the here, the upper part. We already identified this all. Okay, intercondylar eminence, and this is the tibial tuberosity, smooth part, rough part, anterior border. This is the medial tibial condyle, lateral tibial condyle. Okay, and posterior aspect we'll get the soleal line. Okay, soleal line is here. This is the medial border, and we'll get the interosseous border. Anteriorly we'll get the anterior border. Okay, this is the posterior surface, this is the lateral surface, this is the medial surface of the tibia. We'll match this with our bone. Okay, attachment on the medial condyle, semi-membranosus muscle inserts to the groove on the posterior surface. Okay, if this is the medial condyle, then we have the attachment of the semi-membranosus muscle, capsular ligament of the knee joint, and tibial collateral ligament to the upper border. Okay, medial patellar retinaculum attached to the anterior surface. Attachment to the lateral condyle, iliotibial tract to the Gardy's tubercle. Here is that side, the Gardy's tubercle. Okay, also capsular ligament, origin of the extensor digitrum longus and Fibularis longus. Partly it goes up to this level. Okay, we have the digitrum, extensor digitrum longus and the Fibularis longus. Fibularis longus, a part of it come here on the lateral condyle. Okay, the groove on the posterior surface is occupied by the tendon of the popliteus. On the lateral condyle, the groove will get that part is occupied by the tendon of the popliteus muscle. Okay, we got that. Now we go to the attachment of the intercondylar area before backward. That is very important. Attachment of the intercondylar area between the condyle here. Attachment is so important to us. We have to identify this all structure. This is the intercondylar area. Here is the intercondylar area. We must know the attachments. Okay, so from before backward, anterior horn of the medial meniscus. Anterior horn of the medial meniscus, this is the medial meniscus. Anterior cruciate ligament, this is the anterior cruciate ligament. Anterior horn of lateral meniscus. Anterior horn of lateral meniscus. Posterior horn of lateral meniscus. Here, then posterior horn of lateral meniscus. Okay, then posterior cruciate ligament. This is the posterior cruciate ligament. So how can I remember? We have some mnemonic like what? The Medical College Lahore, Lahore Medical College, or Lalmai, Medical College Lalmai, or here medial meniscus, college cruciate ligament. Okay, this is lateral meniscus, Lalmai, again Lalmai Medical College, lateral meniscus, then medial meniscus and posterior cruciate ligament. So we'll make the mnemonic like Medical College Lahore, Lahore Medical College. Okay, if you like that or any other way you can manage. Okay, we have to identify the attachment in the intercondylar area. This is so important to us. We have the most anterior is the attachment of the medial meniscus, then anterior cruciate ligament, then anterior horn of the lateral meniscus, then the posterior horn of the lateral meniscus, and here is the attachment of the, here is the middle meniscus and the posterior cruciate ligament. Okay, so we got the medial college like that of the, here is the attachment like medial meniscus, anterior cruciate ligament. Okay, then we get the anterior horn of lateral meniscus, posterior horn of lateral meniscus, posterior horn of the medial meniscus, and here is the posterior cruciate ligament. We'll remember in that way. Okay, so here is the meniscus. Medial meniscus is very commonly injured in case of sports injury. Okay, what is this? Medial meniscus is a fibrocartilage. This is a fibrocartilage. These are all are collagen connective tissue. Okay, like that of the anterior cruciate ligament here. Okay, here is the posterior cruciate ligament. These are all are collagens. Okay, so these are the structure. We have to remember this all. Okay, attachment to the tibial tuberosity, upper smooth part ligamentum patella. Here upper smooth part ligamentum patella, lower rough part subcutaneous separated from the skin by the subcutaneous infrapatellar bursa. Attachment to the shaft tibialis anterior in upper 2/3 of the lateral surface. We'll get the tibialis anterior. Okay, we'll get tibialis anterior, upper 2/3 of the lateral surface. Here is the lateral surface. Okay, this is the medial surface, upper 2/3 of the lateral surface. Then very important, upper part of the medial aspect of the tibia here is the medial side. Medial malleolus is the medial side. We have three muscle insertion: Sartorius, gracilis, semitendinosus. They are called guy rope. Okay, they are also called guy rope. Okay, we can write it here. They are sometimes called guy rope. Okay, guy rope. Okay, because these three muscles are inserting here. Okay, Sartorius, gracilis, semitendinosus. These three muscle from three group. Sartorius is a muscle of the anterior group. Gracilis is a muscle of the adductor medial group. Semitendinosus is a hamstring muscle. Nerve supply Sartorius, femoral nerve, gracilis, obturator nerve, and the semitendinosus nerve supply tibial part of sciatic nerve. Okay, we got that. Then we get that on the shaft. We'll get attachment of the tibial collateral ligament. Behind those three muscles, we'll get tibial collateral ligament, and these three muscles are inserted by a bursa that is called Anserine bursa. Okay, you can draw that also. That is called Anserine bursa. You have to remember that. Okay, that is called Anserine bursa. Okay, that Anserine bursa is a bursa for the Sartorius, gracilis, and semitendinosus. It looks like the foot of the duck, so it is called Anserine bursa. Okay, we have also here soleus from the soleal line, from the posterior aspect, soleus from the soleal line. Okay, and that is the origin of the soleus. Popliteus, above the soleal line, we have the insertion of the popliteus muscle. Insertion. Okay, we got that. Now we'll go to the attachment of the shaft, medial part of the posterior surface below the soleal line, origin of the flexor digitrum longus. Lateral part of the posterior surface below the soleal line, we have the origin of the tibialis posterior. Tibialis posterior also takes origin from the fibula. Tibialis posterior also takes origin from the interosseous membrane. We have fascia and ligament. Anterior border of the tibia, attachment to the deep fascia of the leg. At the lower part, superior extensor retinaculum. Rough upper part of the fibular notch. We have interosseous tibiofibular ligament. Capsular ligament at the margin of the lower articular surface, we get the capsular ligament. Lower border of the medial malleolus will be the attachment for the deltoid ligament here. Okay, we got that. Now let's go to the next slide. Okay, here we can just assess the insertion origin of the muscle. This is the posterior aspect of the tibia, and this is the insertion of semitendinosus. There is a nerve supply. Nerve supply is from the tibial part of sciatic nerve. This is the popliteus muscle, nerve supply, the tibial nerve. This is the soleus muscle, okay, along the soleal line, okay, nerve supply, tibial nerve. This is the flexor digitrum longus muscle, nerve supply, tibial nerve. This is the tibialis posterior muscle, nerve supply is from the tibial nerve. Look at that, soleus also takes origin from the fibula. Okay, we got that. Here anteriorly we have the tibialis anterior muscle. Here tibialis anterior, we have also the fibularis longus, part of it may take origin from here. Okay, this is the area called Gardy's tubercle for the attachment of the iliotibial tract. Iliotibial tract is the thickening of the fascia lata along the lateral aspect of the thigh. Okay, here in insertion of the popliteus muscle here. Okay, here we have the flexor digitrum longus. This is the tibialis posterior muscle. Okay, we got that. Okay, relation of the tibia at the lower part of the anterior surface of the shaft. Okay, this is the anterior surface of the lower part of the shaft. What are the structure from medial to lateral? Tibialis anterior tendon, anterior tibial artery, deep fibular nerve, extensor hallucis longus, extensor digitrum longus, and fibularis tertius. So from medial to lateral, tendon of the tibialis anterior, anterior tibial artery, deep fibular nerve, extensor hallucis longus, extensor digitrum longus, and fibularis tertius. Relations of the tibia on the lowest part of the posterior surface from medial to lateral. Here we'll get a groove for the tibialis posterior here. Okay, we have also flexor, tendon of the flexor digitrum longus, posterior tibial artery, tibial nerve, flexor hallucis longus, tendon. These are the relationship on the posterior aspect here. Okay, we got that. Now we go to the nutrient artery. That is very important to us. Nutrient artery. Here is the nutrient artery. Okay. Okay. So if you go there, nutrient artery should be on the posterior surface. Here is the posterior surface. Okay. Here is the posterior surface, and nutrient artery close to the soleal line usually. And this is very important artery. This is the largest nutrient artery of the body. Okay, ossification of the tibia, one primary center of ossification and two secondary center of ossification. Upper epiphysis usually include the tibial tuberosity. Tibial tuberosity, we have the upper epiphysis that usually include the tibial tuberosity. Okay. Clinical anatomy, upper 1/3 of the tibia is a common site of osteomyelitis. Tibia may be fractured at the junction between 2/3 and the lower 1/3 of the shaft. Problem is that at that place there is lack of blood supply. Maybe we can say poor blood supply, not lack, poor blood supply, so healing may not be good. Fracture at the nutrient canal site may lead to non-union of the fractured bones. So if a fracture there on the nutrient canal area, okay, involving the neutral vessel, then the fractured site may not heal nicely. Okay. Boot or fracture in ski injury, there is a possibility. Tibia may be used for intravenous infusion. Osgood-Schlatter disease, osteochondrosis of the tuberosity of the tibia. It is seen in adolescent boys or girls, mainly boys, due to disruption of the epiphyseal plate. Also, you have to add meniscus injury to the meniscus in sports when person turn very quickly, keeping the leg on the ground and moving the thigh. Okay, they may have meniscus injury. Usually the medial meniscus is injured or teared. It maybe should be, sometimes it may need to surgery and should be taken out, the broken piece. Okay, and that's all about the osteology of the tibia. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me and have a nice day. Bye now.